Having a smear test or cervical cancer screening. What is cancer and cancer screening? Cancer is when cells in our bodies go wrong. Cancer causes lumps or bumps in our body. We're going to talk about having a cancer screening. This means special tests you can have to make sure cancer is found early and to get treatment as soon as possible if you need it. HPV means human papillomavirus. It is a common virus that doesn't affect most people, but some types of HPV can make the cells in the cervix go wrong. For a small number of people with the cervix, HPV can cause cervical cancer. This is why it's important to get your HPV vaccine if it is offered to you. This is also why it's important to attend your cervical cancer screening, also known as a smear test. What is a smear test? A smear test is not a test for cancer. It's to find changes early, before they turn into cancer. It's taking a small sample of cells from the cervix to check for any changes.
Who needs a smear test? People who have a cervix are offered a smear test from the age of 25 to 64. If you have had sex with a man or woman, you should think about having a smear test. It means any kind of sex and any kind of sexual touching. If you have not had sex, you can still have a smear test. Every person with a learning disability who is registered as female should think about having a smear test. Booking an appointment. You should get a letter in the post asking you to go to your doctor's surgery for a smear test. You will need to call your surgery to book a time and date for your appointment. If you need to arrange a visit to the surgery to meet the nurses beforehand, you can ask for this. You can ask for adjustments to be made for you, for like a longer appointment. You can ask someone to come with you if you are worried. Booking a day when you are not having your period, as this can make the test easier. A female nurse will complete the smear test. On the day of your appointment, make sure you bring your invitation letter with you to the surgery. You will need to wear a face mask during your appointment in line with the current NHS coronavirus guidelines, unless you are exempt. Check in at the reception and wait to be called by the nurse. Once in the room, the nurse will explain what's going to happen, ask you questions if you don't understand something. The nurse will check you understand and will ask you for your consent before you start the smear test. You can stop at any time if you are worried. Equipment used in the smear test. The nurse will show you the equipment before you start the test. A spectrum is a special tube made of plastic which goes inside the vagina to keep it open. This is because when you have a smear test, the nurse will need to see your cervix, which is inside your body. The nurse will use some gel to make it easier and feel more comfortable when the spectrum goes in. Once the spectrum is in, the nurse can see your cervix. They will use a small brush to take a sample of your cells from the cervix. Having the test, you will be asked to undress before waist down. It may be easier to wear a skirt or dress so that you only need to take off your underwear. Try to relax. This will make the test easier. The nurse will help you get into the right position on the couch. The nurse will talk to you about what they are going to do and what to expect. You can stop at any point if you are in pain or feel uncomfortable. Your friend or carer can stay with you, and if you want them to, the nurse might offer another member of the surgery staff to be there. Once the test is finished, you can get dressed. The nurse will let you know what will happen next and how you will receive your results. You can ask questions if you aren't sure about anything. If you are unable to complete your smear test, this is okay. You can talk to the nurse about what might make it easier for you next time. You can always try to do the test again on another day.
After the appointment, you'll get a letter with your results within 2 weeks of the test. If you don't receive a letter, then contact your doctor's surgery. If the result is normal, then you don't need to do anything. You'll be invited for another smear test every 3 years up until the age of 49. Then from 50 to 64, it will be every 5 years. A small number of people will be asked to do the smear test again, or might be sent an appointment for some more tests at the hospital. Your letter will tell you what to do. If you don't understand your letter, you can ask someone to read it with you. If you have any problems with your smear test appointment, you can also speak to your local learning disability team or doctor's surgery. Joe's Trust also have a helpline you can call if you're worried or have questions about your smear test.